Well, good morning, or good evening, everyone. It's 6 o'clock, Tuesday, August 26th, 2025, Tuesday. And we are here every week at 6 o'clock on Tuesday nights from 6 to 7. And you can ask the doctor anything. I'll do my best to try and answer all your questions. Again, this is not meant to be personal management or treatment or advice over the internet or YouTube. Rather, this is to be a discussion and how general practitioners functionally practicing medically trained as your standard medical doctor look at these nutrients, these healthcare advice questions, and how we respond to that. We've been here nearly 25 years since 2002, so we're going to be coming on well, we are almost up to our 25th year come next May. And that will then be a quarter century at this location. We've been practicing functional medicine, or I have alone, since the 1980s. And I have a second doctorate in integrative medicine. Capital University of Integrative Medicine was a university in Washington, D.C. It started in the mid 1990s. And I think it finally closed around 2010, just to lack of funds. It just didn't make it. But at the heyday when I was there in the 1990s, late 1990s into 2000, it took a couple of years additional from my routine work to do that second doctorate. And I got published in nutraceuticals, and my publication was on Juice Plus and the antioxidant benefits of it. And even today, Juice Plus is being chosen for research by the NIH as of a few weeks ago. So we're very familiar with the whole world of integrative medicine, natural medicine, functional medicine, complementary medicine, alternative medicine, whatever term you want to give to it. I just call it good medicine, and being a good doctor, or trying to be a good doctor, praise the Lord, and giving him all the credit. So today we meet, we get these email questions. And if you have an email question and you want to type it into us, you can go to tlcdoctors.com, tlcdoctors.com. And there you'll get our newsletter. You can sign up for that, and you'll get email notification of these meetings. And there's a link there where you can ask these questions in an email form. There's some limited characters, how many characters you can type into your question, so it doesn't turn into a long thesis. So there, then they'll produce this for me so I can try and answer these, or at least give you my ideas on it. The other way to do it is we have some live questions already coming in. So if you're on YouTube and you're logged in, you can go into the chat and type in some of the questions that you have there. And I'll do my best to answer it. If I don't know, I'll say I don't know. I do look certain things up and try and get ready for next week to discuss them again. If this is of value to you and you find it beneficial, so please subscribe and hit the like mark or check the like button, and then we will get more viewership, you might say. So let's begin, and we'll start with our live questions because you're already logged in and watching. So the first one is from Jennifer, and she says, "Hi, Dr. E. A friend is having breast implants removed. What supplements should she take to recover and heal? If Vitalzyme XC, how many a day?" In general, Jennifer, when you have surgery, they tell you to stop eating for about 12 hours. We would extend that to 18 hours to have a lower blood sugar. After the surgery is done, we would ask you to try and remain another 24 hours without eating food. You can drink as much as you can of water. You can put electrolytes in it. And you could have chicken broth and beef broth, which is just like a salty mineralized broth, clear liquid, not bone broth. Why? Because when you're on a fast and it's around 24 to 36 hours, you're going to get more growth hormone repair secreted into your body for better healing. And that will improve the stitching and quickness of repair to be extremely low carb. And when you do eat, I would try and be a carnivore for a week or two because your body needs tons of amino acid and fatty acids to repair the tissues. Fats and proteins are very satisfying and satiating. I would also suggest that you, especially if you're a blood type A, to use digestive enzymes when you're eating the protein rich diet afterwards to heal quickly. The other thing is to drink half your weight in ounces. Uh, so if you're 150 pounds, you would take 75 ounces of water a day. That will improve microcirculation and bring cleansing and removal of debris from the damage from the site of the surgery away from it and process it and bring nutrients for healing those protein rich amino acids and healthy fats that are in your uh, protein rich diet. I would also use systemic enzymes that you suggested, the Vitalzyme XC. Now, remember, you should not use enzymes systemically before surgery. Why? Because Vitalzyme, systemic enzymes, Vascuzyme, these proteolytic enzymes taken on an empty stomach are associated with um, improving inflammation, like little Pac-Men. They clean out your body, the debris, the waste, and inflammation and swelling. But the other thing they do is they increase blood flow, which helps circulation. But if you're doing surgery, that increased blood flow at the capillary level may create a little bit of oozing, a little bit of uh, difficulty thinning the blood, you might say. So we tell all our patients prior to breast surgery, any surgery whatsoever, to stop taking systemic enzymes 4 days before any surgery so it doesn't ooze, you might say. But the day afterwards, we tell you to take the systemic enzymes on an empty stomach and double it for 2 weeks to promote healing and have less bad scarring. And then we would certainly recommend you stay on a low carb diet once you introduce vegetables back in. We would recommend only cooked vegetables because that's easier to digest with your digestive enzyme helping you. If you want to prolong your fast for 48 hours or 72 hours total from the pre op to the post op, we would encourage you to put butter in your herbal tea or coffee, hot water, because it's very satiating. And those fatty acids, especially butter, is named after butyric acid that's in the fat. And it's very nutrient, immune protecting, DNA damage protecting. Another thing is make sure your vitamin D. I probably would take 15,000 international units the week before surgery and maybe 2,000 international units for the rest of the month, 3 or 4 weeks after surgery, and at least stay always on a constant 10,000 international units. My clinical experience is that this is very safe, safe for the liver, even though it's a fat soluble vitamin. And that'll boost your immune system uh, tremendously so you don't get any secondary infections. And then we would certainly recommend, I'm going to always recommend Juice Plus because that's a natural antioxidant shield for free radical damage. So when you have a lot of tissue damage during surgery, free radicals are generated. So taking Juice Plus is very important. And I would take that faithfully all the way through. In fact, the only supplement I recommend to stop would be the systemic enzymes 4 days before surgery, but the day after surgery to take the systemic enzymes on a double up basis. How many? At least anywhere from 3 twice a day to 5 twice a day for about 2 weeks. And then you should see yourself healing nicely with that. We also recommend taking a vitamin C rich intravenous IV the day before surgery with EDTA chelation to improve microcirculation. And then we recommend doing it again afterwards within a week or so. This high dose vitamin C is just very immune boosting. It reduces adrenal stress. Any surgery is a stress to your body and adrenals and cortisol production. So cortisol, if you're under stress, will tear things down, and you want to repair and build things up after surgery. So taking the IV before and afterwards is extremely healing. Like when we do knee replacement surgeries or hip replacements, any kind of a surgery like that, we see tremendous improvement. So let's see here. I'm a little disheveled. There we go. I was out in the car with the wind. My husband took me to Houston's and he got me this little corsage. I don't know if you can see it right here, a little flower on my, for me, because today is my birthday. I worked all day and then I went to lunch at Houston's and I had a prime rib meat with broccoli and it was very, very delicious. And my treat, drum roll, was they didn't have cheesecake, which is my favorite. So I got the 2 scoops of vanilla ice cream with hot fudge. And it was terribly, terribly, disgustingly delicious. And I shared it with my husband. But it was truly, truly a nice treat. And it was a very nice, happy birthday. All right, so that's a little bit about myself and what's going on. Let's see what other questions there are. Mano asked the question, cataract, is there a no surgery option? Well, I'm not an ophthalmologist, I'm not a specialist, but my experience is this. Those of us who eat a low carb diet, exercise, take systemic enzymes, plus Juice Plus as probably the most nutraceutically researched antioxidant in the world. Even my optometrist is, I guess, impressed with my eye exams every year. Now that I'm 72 now, that he doesn't see really this age-related change that often is associated with needing cataract surgery. So I thank the Lord for that. So I would certainly recommend that you be on Juice Plus. And then I've also done EDTA chelation with high dose vitamin C antioxidant, because remember, your cataracts on the lens of your eye is just a type of protein structure that God has created that is translucent. You can see through it. And that protein structure for your lens is able to be burnt or cooked through oxidative stress. So if you don't drink enough water regularly, if you don't circulate microcirculation, if you don't take systemic enzymes to clean away debris, remember I told you years ago I had this large, what do you call it, floater in my left eye. And I mean, it was huge. It was creating like a blockage in my vision. So it was very obnoxious. And I fasted for 5 days, took enzymes and worked and did my exercise, weightlifting 3 times a week and my walking, plus my Juice Plus. And I did my IV chelation. And that sucker was dissolved away, I would say 80-90% within the 5-day fast that I did. And then I paid more attention to how I'm taking care of myself and getting enough adequate sleep and rest. And now that I think I hit my 70th birthday or my 69th birthday when that happened. So I was burning the candle at both ends. So I took a little better care of myself since that floater showed up. Now I can't really even see it in my left eye. Maybe I can see a tiny little fragment left over of it. But so I'm not going to tell you you can get rid of cataracts, but I'm going to tell you should live a life to prevent them. And fortunately for me, with a floater, which is not a cataract, I was immediately upon waking and seeing it develop, I immediately went into action and saw tremendous improvement by doing that with my systemic enzymes, my fasting, my high dose vitamin C, my Juice Plus, my IV vitamin C chelation, and then it just dissolved away immediately. Okay. Tiziana, hi Tiziana. Can we delay Tdap, hepatitis B, hepatitis B, IVP, PCV, RV for newborns? For how long can they be delayed? Of these vaccines, are there any you would not use on your own children? I'm not a pediatrician, and I don't advise patients. My personal thoughts and opinion on this is they have not, the manufacturers of vaccines are not liable for any harm to your child or grandchild. Therefore, they're not really motivated to provide you a safe product. Pediatricians are paid, to my understanding, a bonus for the increased volume of vaccinations they can get quarterly or annually. So there's a monetary bias to get the parent to do it. The vaccine law in 1986 is entitled the National Childhood Vaccine Injury Act of 1986. So it's an injury act. Injury, injury, injury. 3 times I said injury. And why was this law passed in 1986? Because back then we could sue the manufacturers of vaccines. And they were going to stop making vaccines because they were having so many injuries. Therefore, they were required by law to provide safety data every 2 years in that law of 1986, signed by President Reagan. And not one time, to my knowledge, have they ever produced a safety report in all these years. So ever since the 1980s, when my boys were, let's see, in 1986, they were already 4 and, let's see, 6 years old, 4 and 6 years old. I saw that, and I would not give my children vaccinations at all afterwards. I was on active duty, so it was a touch and go thing with my obedience to the U.S. Army then, but I got them protected. And so they're not liable for injuring you. They don't obey the law. And there has been no study comparing them to children who are unvaccinated toward their health protection with natural immunity against all these concerning alleged viruses. And if they can't prove that their usage is superior in long-term health compared to an unvaccinated child with natural immunity alone, then we are talking foolishly here to consider using them. So that's my answer, Tiziana. Why would we? And then you could add to it, those companies have a sordid history of felonious action and manslaughter, and they pay it off with billions of dollars in penalties for unlawful deaths on their products as a practice, rather than requiring any of the manufacturers or owners of these companies to go to jail for this loss of life. And we're talking about hundreds of thousands of deaths from medications these companies have made. A great one, and I'm referring to largely, is Vioxx. They knew it had caused heart disease, and it was given for joint pain, arthritis. And after close to or in excess of, and I can't recall exactly, but it was around 100,000 deaths, it was pulled from the market, and the pharmaceutical was only held responsible, financially penalized for all those deaths. No, I'm sorry. If you go to prison for vehicular manslaughter by an accident, then I think you should be liable to go to pharmaceutical manslaughter. That should be a new law. You tell all your lawyer children in law school and your lawyers to develop the new law, pharmaceutical manslaughter. And when they start spending time in jail, then then I think we'll start seeing uh, improved products available to us. Therefore, when anyone asks me, do I recommend any vaccination whatsoever, I say I cannot, it's impossible to give them informed consent because they hide the science. We have to use Freedom of Information Acts, depend on just judges and courts to make available certain science data that we need to try and learn how to protect our patients and what is safe for them or not. To try and give informed consent is impossible with vaccinations today. So that's my answer. Garden Fairy says, what is your preferred thyroid replacement that is available without supply issues? Well, it's going to be natural glandular porcine bovine source thyroid extract. And who makes it? The biggest producer is Armor Thyroid. That would be my answer, Garden Fury. Oh, happy birthday. Thank you. Thank you. Tiziana says, happy birthday, Dr. E. Thanks for all you do. Yeah. Well, praise the Lord. I'm happy at work and I'm happy serving my patients and God's wonderful creation. That's what I'm happy doing. Constance says, we are national treasures. God bless and protect you. Yes, amen. We are. And unless you realize that really medicine used to be a ministry, it was a service to mankind. And it was the passion of a few that helped develop some of the educational institutions that were very often built under the Christian banner, and the orphanages, and then the healthcare and the hospitals. We have to understand that God has given us a commission to see the majesty in the human body creation. Nobody knows everything about it. And so I get on my knees not infrequently, looking up things about a patient I may have, asking God for guidance. And he said he would lead us into all truth. And that means even our truth in our professional work to help his creation. And I do believe he has kept me ahead of all of this alternative world chatter. Now I see the alternative functional world as becoming corrupt and marketing. Everyone has a vitamin to sell. Everyone has the best drink or the best dietary advice to give or the best nutrient or the best antioxidant. And I've been doing this 45 years, folks. We've been low carb, pro vitamin D, warning about vaccinations since the law was passed in 1986. So look at, there's too many people trying to scam us or just make money. And I'm ashamed of that. They may be very good, but where's the science research, the certification, the clinical trials, the placebo controls? We need to see on all these things that are so great. And maybe some of them are great. Maybe some of them are fantastic. But we need a physician desk reference of nutraceuticals that isn't, there's a tiny one out there. It's always been out there for about 20 years on nutraceuticals and herbs. But this, again, is just co-opted by the pharmaceutical blob to try and control the whole industry of health management of disease. So Uh, I really feel back in the 1990s when I started my second doctorate in this, that I really got to meet some of the greats in European and Oriental medicine that flew into Washington, D.C. to teach us. I was very humbled at their knowledge base on the bioelectric nature of the cell membrane and how we were really energy beings, batteries, vibrational medicine, and how the various oils, uh, essential oils, Bach remedies, um, the certain herbal um, tinctures, all these things were just amazing to be energy according to Vol, the applied kinesiology. Uh, then, of course, the biochemistry of the nutraceuticals of the um, diet. We were never really taught what a healthy human being was biochemically or physiologically. We were just given a 70 kilogram theoretical human being and a range of just basic carbohydrates, fat, uh, and we were never, fortunately, taught that carbohydrates were at all required. And there you go from there. So it's a sad thing when I think about how inferior the medical school is and how it's been captured by the um, pharmaceutical blob, so that the graduates of medical school, who truly, there are some who want to really serve mankind and God, they really think they're getting a good basis. And unfortunately, they're getting a biased basis under the pharmaceutical hospital image conglomerate. Rather than teaching them, learn to become a happy local doctor in a community that you settle down in, that you grow roots in, that your own family and children are raised up in, and interact with the high school and the local uh, uh, city community and council and police, and understand the heartbeat of what it takes to make a healthy community. And you be there faithfully. You help those people. You get to know your patients as they grow up, as they have marriages of their children and grandchildren born, and you just take care of all of them. And you see this wonderful swath of life passing before you, and you just really know, even when they come in, they start complaining about something, and you already know the parents, maybe even the grandparents in their background, and how they their diet, what kind of a lifestyle, what stresses have been in that family, and you can guide them and come to conclusions quicker about what they best need. Now, if you don't know something as a family doctor for the community, then you should have some, certainly not the majority, but some specialists to be able to call upon, because nobody can know everything. And we have probably an 8-to-2 ratio of specialists to general practitioner, family internal medicine doctors. This is pathetic. And that's why everyone is diseased with chronic disease on multiple medicines, rather than developing a relationship with a body of people in a community and saying, you can be healthier. I can guide you there. And we can do follow up, check, and encouragement as you implement these changes in your life toward the betterment. And that will reward you, compliment you, cheer you on, just like your parent or grandparent would cheer you on for the improvements you make in your lifestyle. Because most, we'd say 90% or so all disease is lifestyle derangement. So, well, thank you, Tiziana. I went off on that one down the rabbit trail. All right, next, Alessander says, happy birthday, thank you. Wishing you a year of good health. Yes, well, I am, except for today, I really enjoyed that chocolate fudge on 2 scoops of ice cream, but I split it with my husband. So there's a little reprieve there. And I did have just the steak and the broccoli. We had a appetizer. It was a spinach dip. So I had that. And there you go. And I did have alcoholic beverage. So there you go. See, I'm of the world in a sense to that degree. It was very nice. Um, SPM Jen says, how do I figure out the dosage of nicotine? In general, the research out there and the anecdotal clinical reports for an adult 70 kilogram theoretical human being, a woman is typically somewhere between 55 and 70 kilograms. A man is somewhere between 70 and 85 kilograms that are considered healthy. With that weight, it's about 6 milligrams of nicotine lozenge or patch. So the patches come as 7, 14, 21. And so one patch, or you could cut the patches into thirds if you get the 21 patch. So a 7 milligram patch a day. What else? The lozenges, the one that I have is this thing right here. This is put out by Walgreens, and it is a 4 milligram lozenge, and I just stick it in my between my gums and my cheek, and it dissolves. And this is a 4 milligram. So somewhere between 4 and 6 milligrams is probably all you need as a preventative and help for the uh, ACE receptors in your body that are associated with your antiviral behaviors. All right, and then next is, she asks, is it a patch, a pill, or a lozenge? It comes as a patch or a gum or a lozenge. So though it doesn't come as a pill, I suppose you could swallow the pill, but I would let it slowly dissolve under your, between your cheek and your gum line there. The patch and then chewable gum, I think is 2 milligram and 4 milligram. And that's all the best I can tell you. I'm on an Armour thyroid pill, she goes on to say, for about 4 years now. Can I eventually stop taking them, or is it forever? It depends upon you. So it could be that this low functioning thyroid is a result of autoimmune gut inflammation. If you, let's say, went on a carnivore diet and healed your gut by only having meat, fish, chicken, and eggs basically for 3 months, you probably would heal any possible inflammation in your gut lining in general. And that may actually improve any and all autoimmune phenomena, which is mostly generated by a injured gastrointestinal lining, which is only one cell membrane thick. So it's easy to injure or get a food reaction. So if you did that, and I do follow patients that have done that and have gotten off of their thyroid. And then there are some just who have done that, but it didn't improve enough and they felt better with it, so they chose to stay on it. And that's kind of my position. I am on thyroid and I'm on my natural hormones, but that's all I take. I don't take any prescription synthetic pharmaceuticals. I just take my estrogen, progesterone, and my thyroid. SPM says, for the nicotine, is it taken daily or in a cycle? We don't know what to say about that. Research has to be done. I forget some days. It's sitting right in front of me here every day at my desk here at work. And I have it at home at my desk for my home studying. And most days I take it. And I have been using it for quite some time. I think Dr. Artis, the chiropractor who has done a lot of the research and YouTube teaching on this, is taking it every day. So again, until we have money to do research and doctors willing to do this and talk about it, we're not going to have answers. We're going to be stuck with old doctors like myself and just our clinical experience. So I wish I could give you the answer there. All right, I'm going to go to some of these email questions that have come through. Nori says, what would you recommend for one lump, a 1-inch lump on arm suddenly appearing on 32-year-old female had ultrasound and doesn't seem to be a mass or a growth. Would you recommend biopsy or alternative treatment? Thanks. Well, Nori, um, I would have to physically see that, touch it. Is it sore? Find out your lifestyle. Were you out hiking beforehand? Did you get a bite from an insect? Um, did you get poked by a weed or a little twig that got some organic material under your skin, and now you've made a fibrous wrapping around that? So many times we'll see these little skin fibromas from getting scratches, little pokes from twigs and organic matter to our extremities. And the body seals it off with fibrin. Is it in your axilla or is it on the arm? Is it red? Is it hot? Is it squishy or is it solid? Is it mobile or is it fixed? I mean, I would have to see all these things to give my recommendation. So go to your doctor locally who can check all those things along with the ultrasound and follow their advice, because I have not enough information to give you much more advice than what I've just given you. Asia says, hi, Dr. E. Do you or any of your staff address neurological issues? Well, we address anything that walks through the door because we are general practitioners. And my physician assistants are wonderful general practitioners who are able to, and then we talk about anything they bring to us, we share, so they're able to take on anything that walks through the door. And yes, we have Parkinson's, we have dementias, we have the Alzheimer, we have the brain tumors, we have all kinds of paresthesias, tingling, pinched nerves, sciatica, all manner of neurological, because that's part of being in a human body, and these things can get irritated. So yes, we do use this and work on it. And she goes on to say, my 71-year-old dad is showing signs that are concerning motor issues. So his movement and command seems to be a problem. He has slowed down and lost so much muscle and is not as lucid as he used to be. I know aging can contribute. I'm trying to find a trustworthy doctor. If you have any recommendations, thank you. Well, I know, Asia, you live more close to Los Angeles. I would go to acam.org. Mostly the direction he needs is to get into physical therapy for generalized muscle weakness and get into an exercise program, maybe a water aerobics program. He has to move his muscles because just the action of moving and doing repetitive things is actually teaching the brain to think and react to commands. Physical therapy itself is very good. Exercise is functionally required for memory health. Male hormone replacement therapy, testosterone is very valuable, and also for women. Getting on creatine, being on a very low carb diet, a rich protein or amino acid, perfect aminos is very stimulatory with extra testosterone to help build that muscle. Drinking adequate water for hydration, getting away from alcohol if he's drinking it. So exercise, high protein, carnivore like diet, stop eating at 3 o'clock in the afternoon, creatine, testosterone replacement therapy. Try and improve his microcirculation to his brain with EDTA chelation and high dose vitamin C. Get on a multi-mineral. Get a good night's sleep so he gets some nice deep sleep. Make sure he doesn't have trouble sleeping or any sleep apnea. You could elevate the head of his bed to help the aerodynamics through his air pipes down there, so he gets good oxygenation at night. And then get him involved in anything that he enjoys: walking, playing bowling, cards, singing in church choir, whatever it is that socializes is also very helpful for the motor activities. Those are the directions we would go. And then, of course, he should see a neurologist to consider a brain scan, MRI, with and without contrast, to look for any lesion. But normally the brain is shrinking with age. especially if you don't eat enough healthy protein and fat, because your brain is made largely of fat and protein. So those are the starting points I would go, Asia. Leah says, "Good evening, Dr. Ellithorpe. I'm curious on your thoughts about all the hype over creatine for cognitive function." Well, I've just answered that. It does work. I have read that it's good as we get older to take daily. Thank you and God bless. Yeah, Leah, and I am working with our nutraceutical provider here. We do some designer of our own. My biochemistry, chemistry, and my own publications have looked at some of the things we've developed on our own, have been very successful, very clinically powerful. And my, by the grace of God, my papers are still being referenced, and I'm getting notifications of my email, even on a weekly basis, of people all around the world thankful for what I've published already in my lifetime. So yeah, creatine is being developed now. I should have that product maybe this spring. So I'm in favor of it, but I like to do it myself because I don't trust sources. I think it's such a corrupt world out there. I want to know the manufacturer, the sourcing, and I want reproducibility and accountability chain. So if I don't see what I need, I can hold the manufacturers or providers, sources, liable for what they're giving me. Yeah, so go for it with creatine. Hayden says, my 15-year-old son, basket player, wants to reach his full capacity for height, and he was wondering if it's safe for him to take a couple of milligrams of creatine on the days he does and not eat steak. Well, I'm for eating, for instance, like 8 ounces of steak would give you about 1 gram of creatine, and 5 would be the minimum for a boy or a man. Typically 5 grams a day is what is required. Men often use 10, 15, or 20 to load, and then they'll stay on a maintenance of 5 to 10. So eating an egg will give you maybe 0.3 grams of creatine. Eating a piece of chicken as a serving on a plate would give you another half to 1 gram of creatine. I'm in favor of eating it, but I don't know the sources out there and how good they are. So I'm not against supplementing with creatine all the time. But high sugars are inflammatory and create biochemical stress and are catabolic, tearing you down. And you have to tell them soda pop, juicing, cake, donuts, all this trail mix, all these cereals, all these, processed junk foods are inflammatory, stressful, and catabolic that will shorten his health and height. Not eating late. I don't think a young man or anybody should eat really past 5 o'clock. I think they should wake up to a full king-like dinner at breakfast time, having steak and broccoli or chicken and green beans or salmon and asparagus for breakfast. This is a mythology that John Kellogg and his clique, his religious clique, generated these cereals and have a terrible healthcare blob influence on all of healthcare throughout the world now. Anyway, he eats very clean, high protein, high fat, no junk, is highly motivated and disciplined. Anything else you would suggest that he can do or take? I would do, a protein and vegetable diet. I think cooked vegetables are the best assimilated. He could take perfect aminos that will give all the amino acids, and 5 perfect amino tablets will generate the equivalent of 15 grams of meat. I take 2 doses of that, so I get 30 grams of my protein by just taking 2 doses of the perfect amino acids that we have here. It isn't a powdered, but they taste horrible to me, and they have these sweeteners in it. So I don't like powdered sweeteners, even if it's a good amino acid or supplement you're trying to take. I just think you should eat the real food. He needs to get good sleep. So he has to get the blue light, the lights out, get the room dark, get the electronics out of there. So it stops the stress and catabolic breakdown inhibiting him. And get a good night's sleep, no distractions, get that cell phone out of there. And I would be asleep at 9 o'clock because the first growth stimulating signal electromagnetically from the sunset and the planetary, twist and darkness is at 9 o'clock. That's what jet lag is all about. At 9 o'clock, we get an electromagnetic signal that secretes somatostatins. And if you have food in your stomach and chyme, which is the liquid, churning of the food that you ate hours ago, that from the vagus nerve down into your stomach will shut off the growth hormone. All these kids are eating and snacking junk food, and they're harming themselves thinking that they're going to grow naturally. They should eat the latest around 5 o'clock, and they should not have anything else to eat after that. But their breakfast, their lunch, and dinner should be rich in protein and cooked vegetables, and lots and lots of water. So those are the directions I would go. Hopefully that helps. Constance says, good diet and exercise, no bad habits, plenty of water, 72 years young. What foods help with varicose veins in the legs and ankles? Vitamin C, buffered vitamin C. That's absolutely true. What do you think of beef jerky for protein? Beef jerky has normally packages of good beef jerky from grass-fed sources are like a 2-ounce package to a 4-ounce package. That's what their weight is. And I would say I'm familiar with my that I've used 2-ounce, and it has 11 grams of protein. It has about 2.5 grams of carbohydrates. So you have to be careful. Some of these get a lot of carbohydrates in them. I'm all in favor of beef jerky if it's grass fed and you know that they're not lying to you. Uh, take vitamin C regularly. Try and get 2 to 4 grams in the morning, and maybe another 2 to 4 in the evening. And I personally do this by taking our buffered vitamin C. I've said before, I take the little capsule and I twist it to loosen it so I can open it. And I hold it over my mouth so the powder falls in my mouth. And I just let that kind of sit in my mouth and get absorbed. And it helps handle all the viruses and bacteria and junk around there too. Helps stimulate my gums and growth as well. That's how I do it. John says, Dr. Rita, if for whatever reason you were not allowed to eat any animal protein, what would you eat? I would eat fish protein or poultry protein and eggs and some dairy if it's raw. That's what I would do. Amela says, hi, Dr. E. My son was taking 6.25 iodine for 1.5 years. That's the tablet. Okay. TSH was 1.7, good. When he turned 18, I tested him again for iodine, and his test came back at 60%. I told him to take 12.5 iodine, so she doubled the tablet. His recent TSH level was 0.235, good. I wonder if a 12.5 is too much. No, I don't think it is. He should get a free T3 and get a thyroid antibody, TPO, thyroid peroxidase antibody, and thyroglobulin antibody test. But the 12.5 is just fine. Remember, the Japanese who have a much lower breast cancer and prostate cancer incidence, and life expectancy is longer, much longer than Americans. They include in their diet with all their seaweed and that type of eating are taking in on the average of 12.5 milligrams to 50 milligrams of iodine daily in their diets, and that's including their grown children. So don't worry about it. Get those things checked. Vivian says, what are your thoughts on colostrum? I love it. Helpful or harmful? Well, the New Zealand cow type A Jersey cows are given as a source for our colostrum in our SBI Protect. That's a orthomolecular product, and they are very good with their sourcing. And it's rich in colostrum, so it's very helpful. It helps the immune system. Your first breast milk that is secreted when a baby's born, their first milk from the mother's breast is full of this immunoglobulin generalized antibody protection in the mother's colostrum. So we believe this is very, very good. So grass-fed cows in New Zealand, type of A Jersey cows colostrum is what we use. She goes on to say, my daughter's been taking it and has noticed 2 sebaceous cysts gets bigger, and one on the chest and one on the back. Coincidence? So that's an oily gland in our skin. I don't think it's related. I think it's far more likely she's getting too many carbs and insulin high spiked. Now, your standard doctor doesn't know what is high anymore. He can't find health. If you walked him into a room of healthy people, he wouldn't know how to determine that with the way they teach in medical school. So if you go to a doctor and have your daughter's insulin checked, fasting, it needs to be under 4 on the fasting insulin. Her blood sugar needs to be 85 or less, and her triglycerides should be 75 to 50 or less triglycerides, and her hemoglobin A1C should be 5.3 or less. If those are the numbers, and she's in those healthy ranges, and they're far more liberal, and that's why everyone's gradually getting diabetic, sick, and demented, and immune depressed, because sugar depresses the immune system. So skin bacteria crawl into the pores and inflame the hair follicle and create a sebaceous glandular cyst. I don't think it has anything to do with colostrum. Argentine silver applied topically to these cysts, going on a carnivore-like diet, she should see a tremendous improvement if she takes that with vitamin D. 15 to 20,000 international units if she doesn't have any liver disease, is not an alcoholic or a drug abuser. That amount of vitamin D should safely build up the immune system and help stop these acne, sebaceous cysts. The low carb diet will bring the insulin, triglycerides, blood sugar, and hemoglobin A1C down. And the Argentine silver will help create a general antibacterial, antiviral spray. You can put it on acne on the skin and on the chest if they can't reach. It's easier to use with these sprays. That should be very helpful. And then see the doctor about it. But I doubt that it has anything to do with colostrum. Harvey says, for general health, what would be your top 3 supplements to take every day? I think it depends on age. For an adult, anyone, let's say 25 and older, I would say vitamin D. I would say a multi-mineral supplement that is an Albion amino acid chelated. We have the TLC multi-min. So I would take that. That'll get your zinc, your magnesium, potassium levels up in nice places. So D, a multi-mineral, and Juice Plus. That's what I would do. He goes on to say, also, what would be your top 3 lifestyle behaviors? Weightlifting 3 times a week on machines for 30 minutes, and then a brisk walk for 20 minutes, at least another 3 to 4 times a week, or on the off days. I would be on a low carb diet and stop eating around 3 o'clock in the afternoon. And I would probably drink half my weight in water, try and get structured water, learn about structured water on the YouTube. So, 64 to 96 ounces a day. Get enough sleep. Krista says, hello, Dr. Rita. What, if anything, can be done about non-pregnancy chronic strep B? I think we talked about this in the last time. Again, sometimes this is a normal flora that's going to be there forever. And unless it's creating a problem, it's not actionable with treatment. Living a healthy lifestyle, keeping your immune system optimal on a low carb diet, a healthy amount of exercise, plenty of water, good vitamin D level, and minerals, zinc, and your antioxidants and Juice Plus would be the best thing I would do. Vaginally, symptoms are odorless discharge. Yeah, I think I would just ignore it. If you've had a pelvic exam and your doctor doesn't see anything of concern, then I would just live my life. She had been told that she could take antibiotics, which she does not want to do. Why? What for? And how, what guarantee that it won't come back and you'll be auto reinfecting yourself? Because there's no way you sterilize anything with antibiotics. It can be a normal flora. So you have to understand and challenge your doctors. What on earth logic are you using unless you see a symptom causing thing that you can follow to improvement and a pathogen that you're identifying as the likely cause? Why would you give antibiotics that will create tremendous disruption of the person's health and their gut microbiome that could last up to 2 years? So you got to be serious with these patients. We've hurt them with over antibiotics. So I'm glad you are opposed to that unnecessarily. So she has no other symptoms. So there you go, Krista. That's the answer. Mickey says, what do you recommend for someone taking digestive enzymes, drinking half of their weight in water every day, eating no grains, eating pasture-raised meat and eggs, and yet still constipated? Well, what are you calling constipation? Because if you eat a carnivore diet like that, largely you don't have to have as many bowel movements because you're absorbing into repair all the fat and protein you're made of. So when you eat a diet like that, you don't have as many bowel movements. So it could be normal for you. As long as you have no symptoms, you're passing gas basically every day, and you have a bowel movement every few days or certainly every week, then I don't know that I would be concerned about it. Of course, I don't know you in particular or any other comorbidities you may or may not have, but I would say you have to see your doctor, talk about it, and understand a carnivore diet is associated with a less of a need to having as many bowel movements as we've been blindly thought we need to have. Krista says, hi, Dr. Rita, what would your top 5 supplements be? Well, once again, Juice Plus, vitamin D, a multi-mineral, and then if I could add 2 more, I would have iodine, and I would add systemic enzymes probably. And do a lot of supplements cause your liver enzymes to go up? I have been practicing like this for 35 years or more. I have never seen that happen. Nope. So I wouldn't worry about it. Maureen says, I'm a 64-year-old female. I'm getting a severe stitch on my right side very consistently, just about 30 minutes into my walk. Is this indicative of abdominal muscles needing to be strengthened? Probably. The pain resolves on resting. Any other thoughts on how to alleviate this? Well, if whoever you are, Maureen, I would want to make sure that this is just your musculature and has nothing to do cardiovascularly, because atypical chest pain needs to be ruled out as a cardiovascular cause, and a stitch in your right side may reflect poor blood flow. Now, that's probably unlikely if you're the Maureen that I think you might be. But again, I'm not going to practice over the YouTube. You need to see your doctor, talk about this. Have you had a C-section? Have you had an appendectomy? So these abdominal scars can mess up with scarring some of the skin surface and abdominal musculature, the rectus abdominis muscles. And there could be some poor perfusion when you're getting into more aggressive exercise. Are you drinking enough water? Make sure you're drinking 64 ounces of water at least. Are you taking systemic enzymes to improve microcirculation? Are you eating a lower carb diet? Are you stopping eating or walking after eating, right after dinner? And are you eating too late? And minerals and salt. So salt your food to taste. If you're drinking that much water today, every day, 64 to 8 ounces, and take a Albion mineral chelated amino acid like TLC multiminerals, 3 a day, and see if that goes away. But do see your doctor and make sure this is just the abdominal muscles and minerals. And there are many things that this could be. B vitamins also can create twitches, lack of certain B vitamins. So being on a good methylated B, multi-mineral, systemic enzyme, well hydrated, not eating a high carb diet, uh, and working with your doctor to see if there's abdominal surgical scars and stuff like that, and or ruling out any cardiovascular causes is the direction I would go, Maureen. And Mariella says, hello and thank you. First of all, I started years ago with hypothyroidism and now diagnosed with Hashimoto's. All right, so they found antibodies in your blood serum to certain thyroid tissue. I go to your clinic. Now I'm reading medical medium thyroid healing. Apparently, the root cause of all is Epstein-Barr virus in its different stages. Do you have any input? Thank you. Yeah, this is theory still. This is not established. Any stress, any virus can trigger inflammation, leaky gut, and some molecular mimicry that attacks the thyroid. Food allergies often do it, but viruses can activate it, not just Epstein-Barr virus. You could just as well say an old tonsillitis started to cause it from a strep throat. So no, don't put your money on a virus. They're saying, they claim they're seeing some of these uh, um, DNA or messenger RNA fragments in some of the thyroid tissue samples. But you have to remember, Carrie Mullis, Mullis, was the scientist who developed polymerase chain reaction testing that generated the whole human genome content and research that put down the genome and nailed it. And he said, do not use this PCR technology I developed for diagnosing, because you could raise the cycle of the PCR test up to levels that could find, a Martian's DNA in your blood sample. It's not reliable. You have to set reasonable understanding of what that machine PCR is doing, and you can abuse it. And I think that's what happened to this whole COVID foolishness. They used it up to 40 cycles, 35 cycles, way too high, where you could find a COVID DNA fragment on the moon. Okay, so look at, don't go for this talk about PCR Epstein-Barr viral findings in thyroid tissue from autoimmune disease. That's as provable as there being a Rolls Royce on the moon right now. Prove it. So, all right, dear ladies and gentlemen, let's see. So, Alexander, you're talking about your daughter with your lower eyelid, and you have some inflammation. You have to go to the doctor and have that seen. Yes, hot, warm compresses, Sovereign Silver is very helpful, but I have no idea if she scratched her eye or what's going on. So bring her into her doctor. And yes, the Argentine Silver will be helpful. PJ said, I look forward to your creatine. Yeah, me too. I want to take it. Garden Fairy says, any IV suggestions for flare of sciatica, knee pain, and do I need an order? Yeah, you have to have that. And it would be for the high dose vitamin C anti-inflammatory with the EDTA chelation mini bag, so that you could get better circulation, deliver healing material to the nerve and the tissues. So yeah, that's the direction it goes. All right, everyone, it's 7:04. We've been here an hour. The Lord's blessing to you. Please, if this is helpful and you like it, please like and subscribe. Share it with your family and friends. And remember, there's comments. I always look, a day or two afterwards to see if anyone wrote comments, and I do try and answer those. So God bless you all. Take care of your wonderful bodies that God created, and go for a long, healthy life and helping other people. Good night.